Just to mention, I do use my thumbs a lot, but I think a lot of the strength of my thumbs is actually coming from like you're grabbing, my fingers are actually, like grabbing, and it's just like I'm doing this, and my thumb is just the surface that is applying most of the pressure. But anyway, working up those 4 valleys between the tendons. If you want to, this is also good. I don't do this all the time, but it's also good to work on, the instep and the outstep. On this side. Again, we worked on it on the sole, but it's also good to work more on this border. This is like the spleen channel. Yeah. So.
Got any recommendations for somebody who's flat-footed while on arches?
Okay.
I run into that a lot, so I'm always curious about.
Yeah, that's complicated. Okay. When you talk about arches, okay, so you can work on like more the instep. This is like the spleen channel. Yeah, a lot of people, they really appreciate like the arch and the instep, this whole area, and it feels really like comfortable to work on it just because it's kind of like the shape of it or whatever. The lateral edge is harder. It feels more like you're walking on a blade or something. Because the shape of the this lateral side, the blade of the foot is just like, I don't know, like a ridge or something like that. But you can work on both the instep and the outstep. It's also good to you have your malleolus. So malleolus is like when you look at this crappy drawing, these prominences on either side of the ankle. Those are the malleoli. You have one on the inside and one on the outside. I guess.
The knees, the ankle.
Cankles.
Cankles.
Yeah.
Well, those
The
are
knee
Cankles?
a cankle is a calf that's an ankle.
What?
Someone who's so fat that they don't have ankles, that's what a cankle is.
Oh, I thought cankle is where you get your cardies done.
That's another kind of massage.
Kinky and kinkle.
Okay, so well,
malleolus, okay.
whatever you call it.
Got it, got it.
You can work in a circle, around the malleoli or the canks, whatever. There are a lot of important points that surround the malleoli, like especially on the medial side. You have like the kidney 3, kidney 6, those points now. So it's good to just make a circle around it. Structurally, it's also important. The malleoli, they're actually what happens is like certain muscles and ligaments, they actually go around the malleoli. So it's almost like a joint in a pulley. So yeah, like some of these muscles that actually form the arch, they have to go down, and they're going straight down, and then when they get to the medial malleolus, they actually use it as like a I don't know, fulcrum or whatever, not fulcrum, but like a joint around which it bends and then attaches this way.
Oh no?
Yeah, I'm pushing down.
Well, if you hook your ankle underneath his knee, that would be the
Uh-huh.
final technique on the brown belt.
Oh, right here?
Yeah, push his ankle all the way down underneath his
No way that's happening.
Just sit on him.
Okay. You can either push straight down or you can push
That's a knee
upward
bar,
this way.
right?
Yeah.
Yeah, that's a knee bar.
Okay.
No way that's happening. Pretzel.
Which one is
Vanishing
34?
position.
300,
This is-
340.
There was 36.
Oh.
Okay, this is what they call a vanishing position.
It's like torture.
You put the leg into a
You
number
don't
4
sense
position.
anything
Next
now.
one. Okay. Because this is like the cross, And then, okay. Oh, wait.
Whoa!
So we cross this leg over this
Uh-huh.
way. It's really not that. It's mainly like a straight leg raise.
Now, when he puts that on his shoulder and falls forward, that's called Kobe Erie.
And then, you know, sometimes what they'll do is they'll put the elbow into the sole of the foot just to
Kidney one.
just to
No,
encourage
this is a
the
heel hook. And just put this one over, right? And then grab the ankle.
Then you burn moxa.
Then you grab your moxa.
Smoke it.
Lighter. Light some incense.
Yeah. And meditate.
Then turn on some music.